Right. It's 1:30. We will call the finance meeting to order. And we'll begin with the roll call, please, Desiree.
Commissioner Nieder.
Here.
Commissioner Fashi.
I'm here.
Commissioner Eichelberger.
Present.
We will open it up for public comment. Is there anyone online?
No one online.
We have no one here other than our lovely staff that's presenting. So we will next move to the approval of the minutes of the June 26th meeting.
I'll move to approve.
I can second.
That's moved and seconded. All in favor say aye.
Aye.
Aye. Perfect.
He's on.
Okay, we will roll into the topics of discussion. The first, I believe, is Mr. Shively.
Good afternoon, Commissioners. I am requesting your approval of a contract addendum with Motorola Solutions for the P25 radio system project. This would be a change order number 3. It's a result of our customer design review process over the past couple months and our final review session this past Thursday. The review covered all the tower site and system equipment, addition, removal of items as a result of partnering with the SCIC net, which is the radio system with Dauphin, Franklin, and Adams counties. The overall project cost remains the same. However, the change order does result in a credit of $807,950 available for use for any of our future services, maintenance, or additional equipment we would need for the system. Please note there will be a fairly minimal change order in the future for some additional middleware, equipment, and configuration setup for the regional system, but we didn't want to hold up site equipment ordering until those details were engineered. So, but we'll be able to use a small portion of that $807,000 credit for that when that time comes. And then we'll be back with a small change order for that. So if there aren't any questions or discussion, I would request your approval of the contract addendum change order 3.
Thank you for all of your hard work. And I know we met and walked through a lot of the details of the project and just looking creatively and joining this partnership to save that kind of money. We really appreciate all of your efforts that you've made. And I know you look so forward to getting this fully resolved. And it seems like we're getting close. Thank you.
Well, thank you. It certainly has been a group effort, and I would be remiss if I didn't mention Brian Hamilton, who has done the yeoman's share of the work as our project manager in-house. And I know he's spent timeless hours. And so many thanks to Brian for coordinating everything he has.
Amen. I agree. I apologize about that.
No, that's okay. Thank you.
There any questions of Bob on this matter?
I don't have any. I really think that Bob and Brian and finance staff did a really nice job walking us through this change order. So thanks. Appreciate it very much.
Sure.
Entertain a motion if there are no other questions.
So I'll move to approve.
I'll second.
It's moved and seconded. All in favor say aye.
Aye.
Thank you, Bob.
All right. Thank you all.
Next up, we have Jack Carroll and discussion on the opioid settlement funds.
Good afternoon, Commissioners. I want to give you an update on where we stand with the opioid settlement funding for Cumberland County, but also to present some recommendations on additional allocations that we think you should consider making. As a reminder, we have made 2 commitments of funds to date. The largest commitment was to fund the cost of a medication-assisted treatment program at Cumberland County Prison. That was started in 2023, and the funds were allocated through this calendar year as well. And the total is over $586,000. In addition, you approve the creation of an opioid mitigation coordinator position. That position is kind of taking on the responsibility of serving as a local distributor of the free Narcan that's available to us to provide to Cumberland County residents, and assisting with coordinating programs that are funded with settlement funds and meeting the state requirements, reporting requirements from the state trust fund. The total commitment between the two of those is $640,000. I do want to remind you that the cost of the opioid mitigation coordinator position is shared with Perry County because that position serves both counties. The funds that we received to date, we received a total of 3 payments, are over 1.5 million. When we take into consideration the commitments already made, the 640,000 and change, that leaves us with a balance of 928,424 and a penny that still needs to be allocated and committed in some fashion. Here's another way of looking at that. This is a chart that shows the 3 payments that we received to date, when we receive those payments, and then how much of each payment is on. Oh, it also lists the date by which we're required by the state trust fund to commit or spend those funds. And then it shows how much of each of those payments remains based on the commitments made thus far. You can see that we've committed all of the first payment. The second payment, which must be committed by the end of this calendar year, there's 317,000 left. And the third payment, we haven't yet made any commitments against, 610,000. That shows us that same balance of 948,000. Some key points that we think you should consider in making funding decisions. Some of these are just reminders for you. All money, all settlement funding must be spent in accord with Exhibit E of the multi-state opioid settlement agreement. In Pennsylvania, the state trust fund has been established as the arbiter of deciding what expenditures comply with Exhibit E and which ones do not. Several counties recently received word that some of the expenditures they reported back in mid-March are not in accord with Exhibit E. So we're still in this period, even though we're a couple years into the settlement, of trying to obtain clarity on just what's eligible and what isn't. Cumberland County did report our expenditures, and all of those were approved. So we're not one of the counties that had expenditures denied. Other considerations, as a reminder, over 6 years ago, Cumberland County made the decision to pursue its own opioid litigation. And that decision was based on the costs that had been incurred by the county as a result of the opioid health crisis. The costs that were identified in the lawsuits were costs involving courts, the county prison, probation office, and the expanded need and demand for drug and alcohol services across the spectrum: treatment, case management, recovery support, but also intervention and prevention. As a condition of receiving our share, Cumberland County's share of the multi-state opioid settlement, the county had to agree to drop its own litigation, and the county made that decision. So with the county currently operating with a budget deficit, we believe it's highly appropriate to consider using some of the settlement funds to continue or sustain programs that are currently serving residents with opioid use disorders, and programs that are designed to prevent the addition of additional opioid use disorders among our residents. So that brings us to our recommendation. And our first set of recommendations involve the Cumberland County's problem-solving courts. The county operates 3 different problem-solving courts. Its traditional treatment court that's been in operation for a very long time, overdose intervention court, which was created specifically as a response to the opioid health crisis, and Tom's mental health court. In 2023, the cost of operating these courts to the county was over $1 million. These costs include the salary and benefits of court team members, not their full cost of salary and benefits, but the amount of time they spent on court activities, drug testing costs, and subcontracted recovery support services. Treatment and recovery courts are an eligible expense for settlement funds under Exhibit E. We obtained a lot of information from Paul Polensky, the director of the Criminal Justice Services Department, that provides support for the problem-solving courts. And based on data from the previous 2 calendar years, a significant percentage of the participants in each of the 3 courts identified opioids as one of their drugs of choice. You can see those percentages up there. 23% of the Tom's mental health court participants, 42% of the treatment court participants, and 62% of the overdose intervention court participants. Using those percentages to identify just a portion of the cost of those operating those courts, we project that the cost of continuing those courts through the current 24 calendar year is over $536,000. And we recommend that the commissioners consider allocating opioid settlement funds to cover this portion of the cost of those courts. The following departments have staff on the court teams would receive some fiscal relief if you make that decision. And those departments are the Criminal Justice Services Department, Adult Probation, District Attorney's Office, Public Defender's Office, Cumberland County Prison, our Drug and Alcohol Commission Office, and the Mental Health Office. Let me pause at that point and see if there's any questions about that.
Jack,
Yes,
I won't. So these projections you just gave us are through what years?
the projected cost would be for 2024. It would run from, it would go retroactive to January 1 with the end of this calendar.
Okay, so it's just for the calendar year 24.
Just calendar year 2024.
Okay, all right, thanks.
Any other questions? Our second recommendation has to do with county-funded drug and alcohol services. The demand for services managed by our office have been increasing in recent years. There's a lot of different factors. We're operating with higher fee-for-service rates from all of our providers. Providers have been forced to raise their rates as a response to the staffing crisis that they all experience in recruiting and retaining qualified staff. This past year has also seen medical assistance enrollment drop with the end of the public health emergency for COVID. Re-enrollment kicked back in again, and we've seen a significant drop in the number of Cumberland County residents who now have medical assistance. Those are folks who now turn to our office to cover the cost of their treatment. We have experienced, as most human service departments have, flat funding from the state and federal government for several years now. Our county continues to be one of the fastest growing in the state, and the demand for our school evidence-based prevention services and student assistance services is at an all-time high. For the school year that just ended, we had a record number prevention services and student assistance services delivered. We're projecting that for our fiscal year that just ended, we're looking at a deficit between $425,000 to $500,000. We have planned for that deficit, and we have a reserve fund that we can draw upon. But if we draw all of that money from that fund, it will put our ability to continue providing those services in future years at risk. Treatment for folks with opioid use disorders is an eligible expense in Exhibit E, but also evidence-based prevention services and youth intervention programming are also eligible expenses in Exhibit E. In the face of our budget deficit, an allocation of settlement funding can ensure the continuation of these services for at least a few more years. We are requesting additional funds from the state when opportunities present themselves. We have no idea whether we'll be successful with those requests or not. But we wanted you to know that we're not just looking at opioid settlement funds. So our specific recommendations are that $71,509 of settlement funds be allocated to continue evidence-based prevention services to youth and families. Most of that is going to be school-based, but we also provide those services to community organizations. Student assistance services, we're asking for $85,214 for us to be able to continue the same level of drug and alcohol youth intervention services in the schools. We do some of that as well with our Cumberland County Juvenile Probation Office and Children and Youth Services Department with high-risk kids that they identify and refer to us. And then finally, we're asking that you allocate $15,000 of settlement funds for us to create a reserve pool of treatment funding in the event that we exhaust all of our capped state and federal funding, so that we don't have to turn away anybody in need of treatment for an opioid use disorder. Any questions about those three recommendations for the drug and alcohol department?
Thank you.
This chart is just a summary of all four recommendations and the total amount that you would be committing if you make that decision is $708,001. How we ended up with $1, but we were just running the numbers. That's all I can tell you. And this is the impact it would have on the uncommitted funds. It would leave us with a balance of $220,000 of uncommitted funds by the end of this calendar year. And those funds would need to be spent or committed by about a year, by June 15th of 2025. The presentation wouldn't be complete without also mentioning that there are future funds coming. The fourth settlement payment is due to the county in mid-December. And we know that there is a wave 2 of settlement payments also expected. All of the funds that we received to date have been from wave 1. Wave 2, we keep hearing about it. We don't know when we're going to receive it, but we've received an estimate of what the first payment would be, and it would be considerable. So that's good, because all of these programs that have been funded and we're recommending to be funded will just cover calendar year 2024. And we'll need to consider how we're going to continue those in calendar year 2025. So the additional funding will allow us to do that. We are also continuing to work to see if we can identify other county services that benefit individuals with opioid use disorders that may qualify for additional allocations of settlement funds. And the fact that we have additional funds coming mean that we may also be able to consider funding community initiatives in the future. Questions about? So I'll go back to this slide, which is a summary.
The
of
recommendations. Jack, I have no questions. I know we've spoken about this, but just wanted to thank you and your team for the work that you put into this, being so thoughtful and mindful of the current environment that we're in, and with a real desire to continue great programs. Very candidly, that deficit on those specialty courts was very much on my radar. It's a big number.
It is.
It takes a lot of resources.
It's a valuable program, but it's inexpensive. All three of them are very valuable.
Valuable but expensive, and when you have to make difficult decisions, that when you look at the number of folks that are affected, this will go a long way to really maintaining great services and much needed services. So thank you for that.
Any other questions or comments?
Thanks, Jack. Appreciate it very much.
Gary, did you have any questions or comments for Jack?
The only question I have is, okay, the enumerated costs of the specialty courts, then they're simply going to default back to the general fund after 2024.
At this point, unless a decision was made to use additional settlement. 25.
Okay. All right, that's fine. Thank you.
I don't have anything else.
Do you want to make a motion?
I'm going to move to approve to allocate $708,001 of opioid settlement funds to cover 2024 approved expenses.
I will second.
It's been moved and seconded. All in favor say
Aye.
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 Great.
Thank you very much.
Thank you very much, Jack. Is there any other business to come before the board at this time? Is there anything online? Nothing? Okay, I'll entertain a motion for adjournment.
I move to adjourn.
We are adjourned. Thank you all.